between the muscles. The next group, forceps, and I show for you forceps the next practice. This is hand forceps. This fixated with 6 hooks on your ends. And anatomical forceps, where I find you don't see for this, and surgical forceps. The next, these two retractor and raspator. Raspator, this cubed raspator used for clear periosteum from the bones. Raspator cubed and raspator on this. And this raspator doyen. Doyen is after who describe, for example, about around ribs, for example, and around ribs you clear from the muscles, periosteum, vessels, and the next cutting the ribs. And this raspator catheter, and this female short catheter, this metal in the inferior floor, you show the plastic catheter, and this metal in the surgery. In the therapy, you used plastic catheter. This is catheter for the male. This size near the 25 centimeters. This end oval shape in the urinary bladder. This raspator for the clear from the periosteum and pathology tissue, for example, the necrosis tissue on the bones, and fixation on the tongue. These forceps for the tongue, where students stop story, don't listen for me on the exam. This for the mouth. A retractor for the mouth in the stomatology. For the mouth. Perhaps I will show for next. Так, this forceps very interesting. And this used on these scopes. And these scopes connected the incision on the skin as stapler, and this stapler for the skin. And this metal scopes, the next after the connective tissue, you remove from the body. And this zond on the Russian and with groove. This instrument used after the produced incision on the abscess, and from the groove remove the pus, blood, enough pathology, fluid from the abscess. And this needle from the arteries. Needle doyen, and this after who described when this raspator doyen, this is needle doyen, one after this window you enter thread, and around the arteries produce the sutures, and the next close the knot. This forceps for the gallbladder, where you fixated the gallbladder in the operations cholecystectomy. You take no fingers, you fixate it on the gallbladder and cut in the cystic duct and remove gallbladder from the abdominal cavity. And this forceps, anatomical forceps, with little groove, and surgical with hooks. This forceps for the tissue, how this fixated, this fixated on this, and turn the tissue on the operation place. This is old. This place has name cremaliera. Cremaliera. Close. This instrument clamping the arteries. You stop bleeding the biggest artery, who lies the deepest in the abdominal cavity, in the thoracic cavity, and this is longest. This forceps coher, the cubed coher, and this fixated the organ and clamping the vessels. Or this forceps for the tissue or tzapka, for example, on the tissue. In the Russian has name tzapka. Hooks, the bigger and the small hook. And this increase on the little size the incision and produce a window. And how I nurse take my main surgical and fixate it. How you fixate it? No, the dark no, or this fixated, and these ends and this. And what I take the thumb? I fixated the thumb.